Hi everybody, welcome to this care planning video that will be discussing our new mind map mixed in with the written out portion of our care plan. So the idea behind creating the mind map aspect of the care plan was creating something that might work for different learning styles. The mind map, as you will see, helps you assess and analyze the various aspects of the nursing process known as ADPI. So you assess and analyze. D is for diagnosis. P is for planning. And this involves creating a goal that's specific to the diagnosis and must match the assessment priority, which you'll understand later on. Interventions, depending on your semester, you'll have different goals for your interventions. And lastly, we look at, did our interventions work through evaluating the patient status following implementation of the intervention? So let's take a look at the two aspects in an overview, and then we will break them down further in the following slides. This is the mind map with the ADPI sections. So I've broken them up into sections to help you kind of put the pieces together when you're converting this into this format. And this is the same, the ADPI. You can see the ADPI there. The only part that's not on the mind map is the evaluation aspect, which we'll go over later in this presentation. So the first part of the mind map is really just getting to know your patient. Initials, please do not put their full name on there. DOB, for those of you that don't know, stands for date of birth. Allergies, and all allergies they might have. And the medical diagnosis is going to be placed here. Plus, as nurses, we want to really make sure that we're dealing with any cultural considerations or any family concerns. So this is where you might have a patient from a culture you're not familiar with, and this might be a concern or just something that you want to be aware of or make others aware of. So you can just pop it into that spot. And then this is also about talking with your patient and figuring out what their goals are. At Enloe, you'll often see at the top head of the bed, they have this paper that states, what's important to the patient and what their goal is. So that's one of the things that you can look at there. But it's also just talking with them and finding out what their overall goal is to get them better and get them home. This is where you'll document the abnormal assessment findings. This is also going to include any labs or radiology findings. This is why we include assessment and analyze. As nurses, we not only assess patients, but we analyze aspects of their lab work, radiology, or any other miscellaneous tests they may have had done during their stay. You want to work on getting comfortable with reviewing charts and information that could pertain to the patient's care. We cannot depend on the physician to identify all things. There has been a time or two in my career where I've had to notify the physician of any finding that they may not have been aware of or seen in the chart yet. Because you have to remember, they have a lot of patients and a lot going on. Then we come to the diagnosis portion. And here's where you're going to choose your priority based on your ABCs and from your assessment. So choose that priority and place it here in the box, D. From there, notice the directions of the arrows. Once you decide your priority, take a look at your care plan book and look at the list of NANDA diagnoses that fit with your priority. In the diagnosis book, there's also a section that lists related to that diagnosis. But this is essentially the cause of the diagnosis. Inflammation, bleeding disorder, infection. Like, what is the cause? Not a medical diagnosis, but the pathophysiology that's happening to create that abnormal finding. Now, if the diagnosis is a risk for, so they're at risk for infection, let's say, you're going to have a risk for infection related to surgical procedure or the worry of infection related to that procedure, but you're not going to have an as evidenced by because you don't have any signs and symptoms that are going to explain that. The as evidenced by only works when you have the actual abnormal finding, a related to, and then your signs and symptoms are your as evidenced by. Then here's where you will delineate the priority assessment you chose, and then which is going to go in A, right? So why is this your priority? If you have 10 different abnormal findings, why did you choose this one? And often it's going to be related to our ABCs, right? And that's okay. We want you to know what the priority is. We don't want you to just go into your bag of diagnoses and pull one out, which may be the least important one for the patient. We want you to really recognize what the priority is for that patient and why. And then in the D portion, this is where you're going to write out the diagnosis in the NANDA format. And the NANDA format is written like this. So I took a patient that has a medical diagnosis of COPD exacerbation, and I am using impaired gas exchange, so that fits into my number one priority because their signs and symptoms were shortness of breath, expiratory wheezes, I can't talk today, and these are the signs and symptoms that I've recognized. Now there's also probably going to be some lab values that are out of whack with this patient, but we're just going to focus on these two signs and symptoms. So I have impaired gas exchange, and I chose that because my abnormal signs and symptoms are shortness of breath and expiratory wheezes. But what is it related to? So the medical diagnosis is COPD, but I can't put that, right? Because we can't put medical diagnosis. But I know that COPD, based on the reading I've done and the experience I've done, what you've done as a student, me as a nurse that's worked for a long time, I know that that's an inflammatory process that's occurring, that's creating that impaired gas exchange. So the diagnosis format, or the NANDA format, is impaired gas exchange related to inflammatory process, as evidenced by shortness of breath and expiratory wheezes. And then you can take that and put it back onto that diagnosis portion and just write it out in that format. Next, we come to planning. Planning is based on the diagnosis, and you're creating your SMART goal for this patient. So you have this assessment, why you've chosen it, you have the diagnosis written out in NANDA format, and now we're going to look at planning. So based on the diagnosis, what is your plan goal, realistic for today, and SMART, which is specific, measurable, achievable, relevant to the diagnosis, and time-bound. So you use this portion here to fill it out in sentence portion on the right-hand side. So the little box on the left-hand side in the mind map just kind of helps you use the tools that are in front of you with the mind map to figure out what the best plan would be for this patient based on it all needs to align, your assessment, your diagnosis, your plan, and then next your interventions all need to align with your assessment and your diagnosis. So we've assessed, we've analyzed, we've diagnosed, we've planned, and now we're intervening. This is where we work towards fixing the issue we identified in the patient. So what will you do as the bedside nurse to assist the patient with this diagnosis? Working towards making them better. What are we going to do to help them make this diagnosis better? So let's use the shortness of breath. So my patient has expiratory wheezes and shortness of breath. So I'm also going to know from that they're probably going to have a hard time doing activity. So I'm going to do small activities. I'm not going to make them walk around the unit 20 times. I'm maybe going to make sure that they get up and walk to the bathroom every time they need to go. Or one other thing was I'm going to get them out of bed for meals so that they're sitting up. or put their head of bed up at a 45-degree angle just to make sure that they're able to breathe better. I'm going to look at my orders. I'm going to ensure that their regular breathing treatments are implemented, because as the bedside nurse, it is my job to make sure that orders are done in a timely manner. So those are some interventions that I can add to my care plan. So here's the intervention part. So if you look on the main care plan, you'll see that there's a spot for 5 interventions, up to 5 interventions, and the reasons to the intervention. So we want to know why you're choosing these interventions. And we really do read these. It's important for us to know where your mind's going, and the importance of maintaining these interventions aligning with everything else going on in the care plan. And last is evaluating. Did we accomplish our goal, or at least improve their outcome? Nursing is filled with critical thinking and self-evaluation, and this is where you'll practice this skill. Evaluate what and how your interventions work to improve the situation or outcome for the patient. And if you're unable to improve the outcome, why? What can you do next time to tweak the intervention? Maybe it was too hard of an intervention for that patient. Maybe it was just beyond their capacity for that day. So one thing I know as a nurse is that each intervention will have a different response, which makes sense, right? Because we're all different. So why care plan? Well, you will inevitably hear from every nursing student and nurse how much they remember and potentially hated making care plans in nursing school. And it is a hard concept to master. I would recommend reading care plans and charts at the hospital, which will help you see how they are used in current practice. But care planning in school helps you as a student and us as instructors see how you are progressing in your critical thinking and relating the medical diagnosis to the assessment, to the nursing diagnosis, to planning, interventions, and eventually evaluation. If you remember that this is the tool that will help you connect the dots of complaints, assessments, and interventions to the diagnosis, it will only make you a more well-rounded nurse in the future.